Yeah, I want to talk about a problem that is highly troubling within healthcare, especially accentuated by the events of the last few years. Every day, I'm getting more and more patients coming in and telling me that, I had to wait a month to see my family doctor. I have to wait 3 months for an MRI. I have to wait 6 months to see a specialist. But my pain hurts me now, and I'm worried about what it is and why it is, and if it can get worse, and how it's going to affect my life. Patients are getting zero answers and zero solutions. They're getting pushed off to a later date because no one has the right answers now and no one has the bandwidth to do anything to help them. Well, that's not what it's like here at Spine Advanced Mississauga. It's the exact opposite. In fact, a lot of patients think, wow, you know what? I had no idea my problem was this simple to work on and that somebody actually had the technology and expertise to do that. Now, I say technology and expertise because those two things are stuck together. Regular therapies done by hand, less technologically advanced, more grassroots, a lot of them work phenomenally well. Regular chiropractic, that's the way we functioned here for many, many years. I got into treatment technology because I had a lot of problems with my own neck, back, shoulders that didn't get treated and didn't get solved without the technology. So I brought the technology in and I created new things to upgrade that technology, to make it more effective, to make it help with more patients, and just to basically make it better so people can get better faster. With that comes a lot of capabilities that people don't realize a regular chiropractic office can have. We treat things like knee problems, issues with cartilage, meniscal problems, osteoarthritis, shoulder issues, back and neck. Neuropathy is a big one. So patients that have numbness and tingling in their feet, in their hands, that is actually often a treatable condition, despite what many of your medical practitioners may have told you. Oh, you have to go on this drug. You're going to be on it for life. Oh, it's not working? Well, I'll give you more. Well, it is working? Well, then maybe we're going to give you a few other things to deal with the side effects that that drug causes. What if you could avoid all that stuff? What if you can get the answers faster? Because let's face it here, when you've got a problem, my back hurts, my neck hurts, well, maybe it's, an issue that's easily dealt with. Maybe it's an issue that, you don't have to wait 6 months to find an answer. Because what happens within that 6 months? Oh, well, what could this pain be? Maybe it's just minor. Oh no, wait a minute. Maybe it's major. Maybe it's the sign of another disease process. Maybe I'm going to need a joint replacement. Maybe I'm going to be in a wheelchair. Maybe it's something that's actually going to kill me. Those are all the things that run through a patient's head when they don't have an answer, when they don't have anybody they can ask that can give them what they need. They sit and wait and wonder. And what happens? You sit and wait and wonder and worry. I want to take the worry out of this thing for patients. I want to take the anxiety out of this whole process for patients. That's why you'll find we're pretty relaxed here. In fact, sometimes we're accused of being more relaxed than we should be, just because we want to keep it light. We want to keep people comfortable. We want to make sure that you're comfortable coming in here and getting treated and getting the answers, because let's face it, there aren't a lot of healthcare facilities who operate that way. There are a lot of healthcare facilities that are full of stress and anxiety. We need to be the opposite of that, because what you need is to be able to relax, knowing that there's a solution, knowing that there's at least an answer. Sometimes patients come in and it takes a little bit of time for things to change, for problems to get better, because it takes a little bit of work. It's like going to the gym. Sometimes, to get fit, you need to go 3 times a week for a year. You don't usually need to do that here, but that's the way the body responds with respect to injury. It takes some time for the injury to heal, takes some time for the body's healing processes to do what they do best. And sometimes it takes some technology and some experience and some advice and the right solution to figure out what the solution to your problem is. But the worst thing is not having access to an answer, which is what I find the majority of patients that have been through the regular medical system are getting right now. They're getting pushed off. They're not getting a solution that gives them peace of mind. So if you need some peace of mind, if you or someone you love is suffering from something that they need help with, maybe the least we can do is just give them an answer that'll give them a little bit of peace of mind, someone they can talk to that actually knows what they're going through and actually cares to be able to help. So that's what we are at Spine Advanced. Every one of our practitioners, every one of our staff is wired the exact same way. Only thing we're interested in is making sure that you get the answers and the solutions you deserve. Thank you so much for watching. Really appreciate it, and I really look forward to helping you get the answers and the solutions you deserve.